Welcome back to Public Affairs on Peach. This morning we're taking a look at health issues facing Americans today. Last month, a disturbing report was released that showed a 4% rise in breast cancer diagnoses for young women between the ages of 25 and 39. Experts say the reasons for the increase could be varied, including a lack of exercise, hormones in our food, and being overweight. Jill Binkley is the founder of Turning Point. It's a nonprofit that addresses the needs of breast cancer survivors. Jill, thank you so much for being with us this morning. We appreciate it.
Thank you so much for having me.
First, Jill, what was the driving force behind the launch of Turning Point?
When I went through breast cancer in 2000, I was a physical therapist and still am, and realized going through my breast cancer treatment the large number of physical and emotional side effects of breast cancer and its treatment. And at that time, there was really not a lot of resources in terms of finding answers, how to get over some of these issues, as well as really actually finding help and not knowing what to do with them. And even as a physical therapist, I found a lot of the issues that I faced very confusing and just really didn't know where to turn. And that's really what spearheaded the development of Turning Point.
What are some of the services that you offer and provide?
We offer physical therapy, we offer massage therapy, counseling, and we have a dietitian on staff. We do a lot of patient education as well as healthcare provider education. And we really try to do it, it's all under one roof in a clinic, freestanding clinic, so that we can interact among the healthcare providers there to really meet women's needs in a comprehensive way.
And Jill, how much of this is about rehabilitation after somebody has survived breast cancer?
It really is all about rehabilitation, helping women to get over their surgery and then to get through any other treatments they may have. For example, chemotherapy and radiation have their own unique side effects. And we can do a lot to help women get through that and get through onto the other side and back to their normal activities of daily living.
Jill, this was an alarming number that you shared with me about 29% of cancer patients being referred to rehab. That's not very many. And I'm sure you feel like everybody should be referred to get some sort of rehabilitation.
I think it's a huge issue in the whole area of cancer survivorship, and it's beginning to be addressed and looked at nationally. But certainly, we still know that very few cancer patients in general, and certainly breast cancer patients specifically, very few get that kind of care. Issues related to helping them through those physical side effects of treatment, being referred to counseling, information and actual programs about exercise, just very few, probably less than 20%, as you mentioned, are really referred for that kind of care.
Why do you think that is? Why is that happening?
I think one of the analogies I like to use is that if you had knee surgery, most people know that they'd be referred to physical therapy and would have some sort of exercise program.
Again? Sure.
You'd expect to have some pain and a stiffness and weakness maybe after your surgery. And we have a good relationship, orthopedic surgeons and the rehab field and physical therapists. We grow up together in our education programs. And so that just is part of a natural part of the surgical treatment. In the area of oncology, I don't think it just hasn't been something that the oncology world thinks about is, well, gee, can rehab help, some of our patients? In the area of breast cancer, I think many times, obviously our doctors are helping us to survive this, and that's wonderful. And that's where their focus should be. But what a lot of doctors and medical providers don't realize is how much rehab and physical therapy and exercise can help their patients through that process.
Nearly half of the people who come to Turning Point receive some sort of financial assistance. Either they're uninsured or they're underinsured. Talk about that piece of the society that you're providing for these women that maybe they feel like they didn't have anywhere to go, or then they couldn't pay for it if they did.
One of the issues when we first set up Turning Point was that there's very little of this kind of care being offered anywhere, and certainly not under one roof. And so one of the important parts and aspects of Turning Point was, if we were going to be making this available to women, we wanted to make sure it was available to all women. So that's why we became a nonprofit, and then have donors and grants and other kinds of financial programs that can help women who are in financial need, and we can work with them. So we don't turn any woman away who needs our kind of care.
You are a two-time breast cancer survivor. I'm sure that gives you a unique perspective when you're dealing with these women, and I know they must appreciate having somebody who understands and has walked in their shoes.
I think it does give a unique perspective in that, first of all, women can see that I'm 13 years out and I survived. So there's definitely a feeling of comfort in that, first of all. But I also understand all of the issues that they're going through. I've had them all. I have some of the side effects of treatment that still linger, some issues with my shoulder. I have lymphedema, which is not an uncommon side effect of breast cancer treatment. And so they understand that I've gone through it, and yet I live a full life. I exercise regularly. I do a lot of very active kinds of things, and so that is a comfort as well. Many of our staff at Turning Point are either breast cancer survivors ourselves, or they've certainly gone through it with a close family member or friend. So we really do understand the issues that women face.
You're celebrating the 10th anniversary of Turning Point. Where do you see this organization in 10 years?
Oh, in 10 years. We've certainly come a long way in the first 10, in that, you know, when we first opened our doors, we would get, you know, see 5 or 6 new patients a month. We now are seeing about 30 newly diagnosed women every month at Turning Point, which is amazing. So over 300 women a year come to Turning Point. Looking forward, one of the areas that we've been working very hard in is really advocating and promoting that all women should receive this kind of care. Turning Point will never be able to handle that kind of volume, so we've really turned our attention to advocacy and promotion, teaching healthcare providers what they need to know in order to offer this in their own community. And we have physical therapists and other rehab professionals will come in and learn from us. We also have other programs where we go out and teach healthcare providers and educate other people to do this. So I would see in 10 years that we will hopefully, again, be more working on spreading the word and trying to get more and more women seen in this kind of care.
Jill, thank you for your time today and for sharing some of the insight.
Thank you so much. I
It was
really
a pleasure
appreciate
to meet
being
you.
here. Thank you.
Stay with us. Coming up this morning, insurance companies take a lot of heat for rising premium costs, but is it really their fault? The real cost of health care. That's when we come back.